Do you ever wonder what it was truly like to grow old in a time without modern medicine? Do you ever ask yourself what happened when your teeth started falling apart, when every meal became a battle, and when pain was a constant companion in medieval old age? Number 1. Gnawing pain was a constant companion. Imagine the daily grind of existence in the medieval world. Now layer onto that the relentless throb, the sharp jab, the dull ache of failing teeth. For those reaching old age in this period, chronic dental pain was not a rare misfortune, but a widespread, almost universal experience. This was a world without pain relievers as we know them, a world where a toothache could truly incapacitate a person, making even the simplest acts of living a supreme effort. The primary culprit for this agony was tooth decay, a condition rampant across all social strata. While modern diets rich in refined sugars are often blamed for widespread cavities today, medieval diets had their own destructive forces at play. Coarse, unrefined grains, often containing particles of the millstones used to grind them, created a rough, abrasive texture. These tiny grit particles, when chewed daily over decades, slowly but surely wore down the protective enamel layer of teeth. Once the enamel was breached, the softer dentin beneath became exposed, vulnerable to the acids produced by oral bacteria. These bacteria thrived in the mouth, feeding on food particles and sugars naturally present in the diet. Even if refined sugar was a luxury, the process was slow, insidious, and unrelenting. As decay progressed, it burrowed deeper into the tooth, forming cavities that grew larger and larger. When the decay reached the pulp, the soft, living core of the tooth containing nerves and blood vessels, the real torment began. The pulp became inflamed, a condition known as pulpitis. This inflammation, confined within the rigid walls of the tooth, created immense pressure on the delicate nerves, resulting in excruciating pain. This pain could be spontaneous, striking without warning, or triggered by hot or cold foods and drinks, or even by simply biting down. It was a constant, unwelcome presence, making sleep difficult and concentrating on daily tasks nearly impossible. Chroniclers of the time, though not always detailing individual suffering, hint at the widespread nature of such afflictions through references to tooth drawers and various folk remedies. Skeletal remains from medieval burial sites offer a stark and undeniable testament to this suffering. Paleopathological studies consistently reveal high rates of dental caries in adult populations, with many individuals showing multiple decayed teeth, often extending into the pulp chamber. Beyond mere decay, the infection often spread from the diseased pulp into the bones surrounding the tooth root, forming an abscess. These periapical abscesses were reservoirs of pus and bacteria, causing intense localized pain, swelling of the gums and jaw, and often a generalized fever. The face could become visibly distorted, with a swollen cheek or jowling, a clear sign of the raging infection within. The pressure from the accumulating pus could be so great that it sought an outlet, sometimes forming a fistula, a small, through the gum or even the skin of the face, allowing the pus to drain. While this drainage might provide temporary relief from the pressure, it meant a persistent, foul-tasting discharge into the mouth and a constant source of infection. Such conditions were not fleeting. They could last for weeks, months, or even years, flaring up with renewed intensity. The constant battle against infection drained the body's resources, leaving individuals weakened and vulnerable to other ailments. The deep-seated nature of these infections meant they were often intractable. The body's immune system, while valiant, was often overwhelmed by the persistent bacterial assault. The pain, swelling, and systemic symptoms, like fever and malaise, created a profound impact on an individual's quality of life. An old person, perhaps already frail from a lifetime of hard labor or malnutrition, would find their remaining strength sapped by a chronic dental abscess. Eating became a nightmare, sleep an elusive dream. The pain was not just physical, it was mentally exhausting, a relentless assault on the spirit. Without effective antibiotics or even basic antiseptic practices, these infections rarely resolved on their own unless the offending tooth was somehow lost or extracted. And even then, the remaining infection in the jawbone, known as osteomyelitis, could persist, causing further pain and complications. Archaeological digs frequently unearth skulls with clear evidence of such infections, piercing extensive bone destruction around tooth roots, healed or unhealed abscess cavities, and even fistulous tracts. These silent witnesses tell a story of immense, sustained suffering that was an inescapable part of growing old in the medieval world, a constant gnawing presence that defined daily existence for many. Number 2. The only cure was often brutal extraction. When the relentless pain of a decaying tooth became unbearable, or an abscess swelled the jaw to a terrifying degree, the only viable cure in the medieval period was extraction. This procedure, however, bore little resemblance to the meticulous, sterile, and pain-free experience offered by modern dentistry. Instead, it was often a terrifying, brutal ordeal, fraught with risk and guaranteed suffering. There were no qualified dental surgeons as we understand them today. Tooth extractions were typically performed by a diverse group of individuals, ranging from itinerant tooth drawers who plied their trade at markets and fairs, to barbers, blacksmiths, and even in some monastic settings, monks with some medical knowledge. The common thread among these practitioners was a distinct lack of formal anatomical training or an understanding of sterile technique. Their tools were crude and often unsanitized, pliers often of the sort used for other trades, or specialized but equally rudimentary forceps were the instruments of choice. Sometimes, a hammer and chisel might be employed, particularly for stubborn teeth or roots, a testament to the sheer force applied. The patient, already in agonizing pain from the tooth, would be subjected to the additional torment of the extraction itself with little to no effective anesthesia. Strong alcoholic drinks were sometimes administered to dull the senses, or herbal concoctions containing opium, mandrake, or hemlock might be offered to induce a state of stupor or drowsiness. However, these preparations were imprecise, dangerous in their dosage, and often failed to truly eliminate the searing pain of bone and nerve manipulation. The patient might be held down by assistants or straps, their mouth forced open. The practitioner would then attempt to grasp the offending tooth with their unsterilized pliers. The goal was often simply to remove the tooth as quickly as possible, regardless of the trauma inflicted on the surrounding tissues. There was no gentle rocking to loosen ligaments. Instead, brute force was frequently applied. The sound of cracking bone, the tearing of tissue, and the screams of the patient were common accompaniments to such procedures. The immediate complications of a medieval tooth extraction were numerous and severe. A common occurrence was a fractured tooth, where only a part of the crown broke off, leaving the painful root still embedded in the jawbone. This left the patient in an even worse state, as the source of infection remained, often leading to further abscess formation and making subsequent attempts at removal even more challenging. Fractures of the jawbone itself were also a significant risk, particularly with the use of excessive force or leverage. A broken jaw was not only intensely painful but also made eating impossible and opened the door to further potentially fatal infections. Hemorrhage was another serious concern. Without knowledge of coagulation or effective methods to stop bleeding, a persistent bleed could weaken an already frail old person or even prove fatal in rare instances. Perhaps the greatest danger, however, lay in the realm of infection. Aseptic technique was entirely unknown. The tools used were rarely, if ever, cleaned beyond a cursory wipe. The practitioner's hands were undoubtedly dirty. The patient's mouth was already a breeding ground for bacteria. Introducing fresh wounds into such an environment was an open invitation to catastrophic infection. Post-extraction infections were common, manifesting as swelling, fever, pus formation, and spreading into the surrounding tissues and bone. These infections could lead to systemic conditions like sepsis, where bacteria entered the bloodstream and spread throughout the body, rapidly leading to organ failure and death. Chronic osteomyelitis, a persistent bone infection, could also develop in the jaw, causing long-term pain, disfigurement, and repeated abscesses. Skeletal remains from medieval cemeteries sometimes show evidence of massive bone loss and remodeling consistent with failed extractions and subsequent chronic infection. The fear of the tooth drawer was palpable. Seeking their services was a desperate last resort, a choice between enduring unbearable pain or submitting to a procedure that offered a high probability of further suffering, disfigurement, or even death. For the old person, already facing the vile-nidities of advanced age, this brutal cure was a terrifying prospect, a leap of faith into a dangerous unknown undertaken only when the agony became truly unendurable. The experience left not only physical scars but also a profound psychological impact, a lasting memory of intense suffering and the terrifying realities of medieval medicine. Number 3. Your diet actively wore down your teeth. The food consumed daily in the medieval period, while providing sustenance, was also a primary antagonist to dental longevity, actively working to wear down teeth and contribute to decay. Unlike today's highly processed, soft, and refined foods, the medieval diet was inherently abrasive and demanding on the oral structures. The most significant culprit was the ubiquitous consumption of bread, a staple for nearly every segment of society. Grain, typically wheat or rye, was ground into flour, using cornstones or larger millstones. These stones, whether hand-operated or water-powered, were made of natural materials like sandstone or granite. As the grain was milled, tiny particles of the stone inevitably broke off and became incorporated into the flour. These microscopic fragments of grit, though seemingly insignificant, accumulated in every bite of bread. Over a lifetime of eating this gritty bread, these abrasive particles acted like sandpaper, slowly but relentlessly grinding down the occlusal surfaces, the chewing surfaces, of the teeth. This process, known as attrition, led to extensive wear on the molars and premolars, the teeth primarily responsible for grinding food. Skeletal analyses of medieval populations consistently showed teeth worn down to an astonishing degree, often exposing the underlying dentin, the softer yellowish layer beneath the enamel. In severe cases, the wear could even reach the pulp chamber, leading to infection and pain similar to what happens with deep decay. Exposed dentin was also highly sensitive to hot, cold, and sweet stimuli, making eating a painful experience. The abrasive nature of the diet was not limited to bread. Many other foods were tough, uncooked, or required extensive chewing. Root vegetables, when available, were often consumed raw or minimally cooked, demanding considerable masticatory effort. Meats, particularly for the less wealthy, were tough, fibrous, and often of animals slaughtered in old age, requiring considerable force to tear and chew. There was no tenderizing process as we know it, no slow cooking methods to break down muscle fibers in the same way. The lack of refrigeration meant that preservation methods often involved drying or salting, which could make foods even tougher and more resistant to chewing. Imagine tough, dried salted fish or dried meat requiring prolonged and forceful chewing. Even fruits, when seasonal, were often harder than modern cultivated varieties. Nuts and seeds, when consumed, also contributed to the abrasive wear. The constant mechanical stress and friction from these hard, gritty foods meant that teeth were under perpetual assault, their protective enamel gradually eroded, and their internal structures subjected to continuous pressure. This constant wear not only led to dental pain and sensitivity, but also increased the risk of tooth fracture, especially in older individuals whose teeth might already be compromised by decay or weakened by bone loss. A fractured tooth could then become a major source of infection and intense pain, as the fracture line created an entry point for bacteria into the pulp. Beyond the physical wear, the nature of the medieval diet also contributed to the accumulation of dental calculus, commonly known as tartar. Without regular, effective dental hygiene practices, food debris and oral bacteria rapidly formed plaque on tooth surfaces. This plaque, if not removed, became hardened by minerals in saliva, forming calculus. Calculus deposits, particularly around the gum line, provided a rough surface for further bacterial accumulation. These bacteria released toxins that irritated the gums, leading to inflammation, bleeding, and eventual gum disease or periodontitis. As the gum disease progressed, the supporting bone around the teeth began to resorb, weakening the teeth's anchorage in the jaw. This process, coupled with the relentless attrition, meant that by old age many individuals had loose, painful teeth, prone to further decay and eventual loss. The combination of dietary abrasion, lack of hygiene, and the resulting periodontal disease created a cascade of dental problems that culminated in severe oral deterioration for those who lived into their later years. The very act of eating, essential for survival, was simultaneously a destructive force, slowly dismantling the foundation of their dental health over decades of medieval living. Number 4. Superstition and folk remedies offered false hope. In a world without scientific understanding of bacteria, infection, or anatomical dentistry, the agony of dental problems in medieval old age was often attributed to supernatural forces or mysterious humors. This void of knowledge was filled with an array of superstitions, charms, and folk remedies, none of which offered genuine relief or a cure, providing only false hope. A deeply ingrained belief was that tooth decay was caused by a toothworm, a tiny, invisible creature that burrowed into the tooth, gnawing away at its substance and causing pain. This belief, pervasive across many cultures and enduring for centuries, shaped the approach to treatment. If a worm caused the pain, then the solution must be to expel or kill the worm. Various ritualistic practices aimed at achieving this. One common remedy involved burning a candle or incense near the aching tooth, allowing the smoke to enter the mouth, supposedly to fumigate the worm out. Another method involved placing specific herbs, often those with strong odors or bitter tastes, directly onto the tooth or into the ear on the side of the affected tooth in the hope that the worm would be repelled. Beyond the toothworm, medieval society frequently turned to religious intervention and saints for relief from suffering. Saint Apollonia, a Christian martyr whose teeth were supposedly pulled out during her torture, became the patron saint of toothache sufferers. People would pray to her, wear amulets with her image, or carry small relics in the hope that her intercession would alleviate their pain. Processions and pilgrimages were sometimes undertaken, all in a desperate attempt to find divine comfort and healing for a condition that medical knowledge could not address. These acts of faith, while offering psychological solace, did nothing to stop the bacterial infection or the physical destruction of the tooth. Other folk remedies involved highly unusual and often repulsive substances. Pigeons, dung ground and mixed with honey might be applied to the tooth. A common ingredient in many medieval medicinal practices due to its perceived cleansing properties might be gargled or applied. Frog's blood, ashes of burnt moles, or even the teeth of specific animals like pigs or dogs were believed to hold curative powers when worn as amulets or applied in poultices. These remedies, often based on sympathetic magic or ancient lore, ranged from harmlessly ineffective to actively harmful, potentially introducing more bacteria or causing chemical burns to delicate oral tissues. Herbal remedies were also widely employed, with varying degrees of actual effect. Opium, poppy, known for its pain-dulling properties, was certainly used, though often in uncontrolled and dangerous dosages, leading to stupor rather than precise pain management. Other plants, like mandrake root, henbane, or hemlock, were used for their sedative effects, but their toxicity made them equally perilous. More benign herbs like chamomile or cloves might have offered some mild temporary relief from inflammation, or acted as a local anesthetic due to compounds like eugenol in cloves, but they certainly did not cure the underlying infection. The sheer variety of these remedies, often contradictory and bizarre, speaks to the desperation of medieval people seeking any form of relief from relentless tooth pain. People tried everything from the seemingly rational application of herbs to the truly outlandish, driven by the agony and the absence of effective alternatives. The lack of scientific understanding meant that even when a tooth was extracted, the cause of the problem was not understood, and preventive measures were non-existent. Without knowledge of hygiene or the role of bacteria, the cycle of decay and infection simply continued in other teeth. Old people, having endured a lifetime of such remedies, were likely to have tried countless ineffective treatments, their suffering persisting despite their earnest efforts and beliefs. The reliance on superstition and unproven remedies meant that genuine healing was largely a matter of chance, or the body's own limited ability to fight off infection. For conditions as entrenched as deep dental decay and abscesses, these faux treatments offered nothing more than a fragile shield against an onslaught of pain, leaving the individual to suffer a relentless battle with an invisible enemy, armed only with false hope and ancient beliefs. The true brutality lay in the perpetual cycle of suffering, unalleviated by any genuine understanding or effective intervention, perpetuating a state of chronic discomfort and fear for those in their later years. Number 5. Eating became a daily agony and social challenge. For an old person in the medieval period, the simple act of eating, a fundamental necessity for survival and a significant social ritual, could transform into a daily agony. The relentless onslaught of dental problems, missing teeth, painful cavities, sensitive exposed dentin and inflamed gums conspired to make mastication a supreme effort or an outright impossibility. When teeth were decayed to the point of being painful to bite on, or when multiple teeth were missing, the ability to properly chew food was severely compromised. Tough meats, coarse breads, and fibrous vegetables, staples of the medieval diet, became formidable challenges. Even soft foods could trigger sharp pain if they encountered exposed nerves or sensitive areas. This meant that the range of foods an old person could comfortably consume drastically narrowed, often restricting them to pottages, broths, and finely minced ingredients, if such preparation was even available to them. The inability to chew properly had profound consequences for nutrition. Coarse grains, though abrasive, were a vital source of calories and nutrients. If an old person could not chew them, or if their stomach was distressed by poorly masticated food, their nutritional intake would suffer. This could lead to a state of chronic malnutrition, compounding existing frailties of old age. Weakness, fatigue, and increased susceptibility to disease became more pronounced, creating a vicious cycle where poor dental health led to poor overall health. The body, already struggling with the natural decline of aging, was further weakened by a lack of proper nourishment due to an inability to process food effectively. This diminished physical capacity meant that even simple tasks became harder, further reducing an individual's quality of life and potentially shortening their lifespan. Beyond the physical hardship, the struggle to eat also presented significant social challenges. Meals in medieval society were often communal affairs, whether within a family unit, a monastic community, or a lord's hall. The inability to participate fully in these meals could lead to isolation and social marginalization. An old person who struggled to chew, who ate slowly, or who had to restrict their diet to soft, less desirable foods might be seen as a burden or an inconvenience. The visible signs of dental deterioration, such as sunken cheeks due to missing teeth or the grimace of pain while eating, could contribute to an altered perception of the individual. They might be pitied but also potentially ostracized or simply overlooked, particularly if resources were scarce. Social interactions often revolved around shared food and drink, and a person unable to partake easily might find themselves excluded from conversations and camaraderie. The constant pain associated with eating also meant that meal times, which should have been a source of comfort and sustenance, became a source of dread. The psychological toll of this perpetual struggle should not be underestimated. The daily reminder of their failing body, the constant negotiation with pain just to eat, could lead to a profound sense of despair and diminish their overall enjoyment of life. The appearance of a sunken mouth, a hallmark of extensive tooth loss, also carried social implications. It was a clear, visible marker of advanced age and decay, impacting one's self-image and how one was perceived by others. While old age was sometimes respected for wisdom, the physical signs of extreme dental decline offered a grim visual testament to suffering and decline, sometimes associating it with poverty or ill health, even if the person was not impoverished. For the old person in medieval times, their mouth told a story of a lifetime of wear and tear, a battleground where every meal was fought, and where the constant fret of pain hung heavy over one of life's most basic and essential activities. The simple pleasure of food was often replaced by a daily ordeal, a stark reminder of their vulnerability and the harsh realities of their dental decline. Number 6. Dental infections could easily kill you. While toothache might seem like a mere discomfort in the modern age, for an old person in medieval times, a severe dental infection was a direct threat to life. In a world devoid of antibiotics, a spreading bacterial infection originating in the mouth could, and frequently did, lead to devastating systemic consequences, often resulting in agonizing death. When a tooth abscess, a collection of pus at the root of a tooth, was left untreated, the infection did not remain localized. It would spread, eroding bone and pushing into surrounding soft tissues. The jawbone itself could become extensively infected, a condition known as osteomyelitis. From the jaw, the bacteria could track along facial planes, the connective tissue layers that separate muscles and organs, reaching critical areas of the head and neck. One particularly terrifying path of infection was into the submandibular and sublingual spaces, the areas beneath the tongue and jaw. This type of infection, if it became severe, could lead to a condition similar to what modern medicine calls Ludwig's angina. Ludwig's angina is a rapidly spreading aggressive cellulitis, a bacterial infection of the soft tissues on the floor of the mouth and neck. As the infection progresses, the tongue can be pushed upwards and backwards, swelling to such an extent that it obstructs the airway. This leads to acute difficulty, breathing a suffocating sensation, and without intervention, certain death. There was no concept of a tracheotomy, a surgical procedure to create an airway in the neck, in a way that would have saved such a patient in the medieval period. The slow, agonizing suffocation caused by such an infection was a silent killer stemming directly from what started as a simple toothache. The lack of antibiotics meant that the body's own immune system was the sole defense against such aggressive pathogens. An old person, often already weakened by malnutrition, other chronic illnesses, or the general frailties of age, would find their immune system overwhelmed. The infection could also spread upwards into the skull. Bacteria could enter the brain through various pathways, causing meningitis, an inflammation of the membranes surrounding the brain and spinal cord, or a brain abscess. Both conditions were universally fatal in the medieval era. Symptoms would include severe headaches, fever, confusion, seizures, and eventually, coma and death. The route of infection could also be downwards, into the chest cavity. Mediastinitis. An inflammation of the mediastinum, the space in the chest between the lungs, is a rare but extremely dangerous complication of dental infections. The infection could spread from the neck downwards along fascial planes, leading to a collection of pus and inflammation in the chest. This would cause severe chest pain, difficulty breathing, and rapid deterioration, almost certainly leading to death. Perhaps the most insidious danger was sepsis, or blood poisoning. This occurred when bacteria from the localized dental infection entered the bloodstream and circulated throughout the entire body. Once bacteria were in the blood, they could infect any organ, leading to widespread inflammation, organ dysfunction, and ultimately septic shock. Sepsis would manifest with high fevers, chills, rapid heart rate, confusion, and eventually a precipitous drop in blood pressure and multiple organ failure. Skeletal remains from medieval burial sites often bear silent witness to these fatal infections. Paleontologists examining ancient bones frequently observe extensive bone destruction around tooth roots, evidence of widespread abscesses, and sometimes signs of systemic infection that spread far beyond the jaw. Healed lesions suggest that some individuals survived, but unhealed or particularly destructive lesions, especially in the context of other signs of poor health, indicate that dental infections were a significant cause of mortality. For the old person, already navigating a precarious existence, a severe toothache was not just a source of pain. It was a potential death sentence, a reminder that even the smallest infection could rapidly escalate into a life-threatening crisis in a world without modern medical interventions. The sheer vulnerability to death from what we now consider a minor ailment highlights the brutal reality of medieval dental health. Number 7. Your face told a grim story. For an old person in the medieval world, their face often served as a living testament to the brutal realities of their dental health. It was a canvas upon which a lifetime of neglect, pain, and loss was visibly etched. The cosmetic impact of severe dental deterioration was profound, far beyond mere aesthetics. It affected speech, eating, and, ultimately, how one was perceived in a society that offered no modern prosthetics or corrective procedures. The most striking visual manifestation was the widespread loss of teeth. Years of decay, infection, and brutal extractions meant that by old age, many individuals had gaping spaces where teeth once stood. As teeth were lost, the alveolar bone, the part of the jawbone that supports the teeth, began to resorb. This bone loss caused the jaw to shrink, leading to a significant alteration of facial structure. The cheeks would sink inwards, giving the face a hollowed, gaunt appearance. The lips would also collapse inwards, creating a characteristic senile prognathism, where the chin appeared to protrude and the nose and chin seemed closer together. This distinct facial profile was an unmistakable sign of advanced age and extensive tooth loss. Beyond missing teeth, chronic inflammation and infection contributed to a generally unhealthy facial appearance. Gums might be chronically swollen, red and tender, due to persistent periodontitis. Abscesses could cause significant localized swelling of the cheek or jaw, sometimes leading to a visible lump or even a draining fistula, a small opening on the gum or skin of the face from which pus would periodically ooze. This constant discharge, combined with the general accumulation of bacteria and decaying food particles in a mouth ravaged by disease, led to severe and persistent halitosis and extremely foul breath. This was not merely an unpleasant odor, it was a constant, undeniable sign of infection and decay within the mouth, something impossible to hide during close social interaction. The visible signs of suffering, from the grimaces of pain while attempting to eat, to the constant adjustment of the jaw, were also a daily reality for these individuals. The impact extended to communication as well. Missing teeth, especially the front teeth, severely affected speech. The inability to properly form certain sounds, particularly sibilants like sis or s-hey, led to a lisp or a general difficulty in enunciation. This could make an old person harder to understand, further isolating them in social situations. The sunken facial features and the difficulty with speech contributed to a general perception of frailty and decline, often regardless of an individual's actual mental acuity or wisdom. While old age was revered in some contexts, the visible signs of a deteriorating body, especially the mouth, could diminish a person's standing and interactions. Marriage prospects, even for older widows or widowers, would be impacted by such disfigurement. The ability to chew and speak clearly were fundamental to daily life and social acceptance. The visual evidence of dental decay was not just discomforting. It was a grim billboard advertising a lifetime of pain and a precarious future. There were no dental prosthetics, no dentures of any meaningful kind for the common person to mask these losses or restore function. Once teeth were gone, they were gone forever, and the facial changes they wrought were permanent. An old person could not hide their dental reality. It was etched into their very being, a constant visible reminder of their suffering and the harsh realities of their existence. Their face told a grim story, a testament to the brutal truths of medieval dental health, reflecting not just physical decay, but the social and psychological toll it inflicted upon those who lived into their later years.